add in, any questions that you might have. It just opens up the dialogue and maybe gets you thinking about something that might be of interest. Good morning, Lucy and Desiree and Gerald. Thanks for being here. Appreciate it. I want to thank one of my listeners, Eddie. He got me a warm stocking cap. Obviously, the Dodgers. He's from California. And I don't think that I would have realized it would have been, with the wind chill, 9 degrees right now. It is quite a shock to the system, and I was not prepared. Again, it was a shock. We go from 65 to 9. Yeah, it was tough this morning, taking a walk. I thought I prepared, but yeah, I got to do better with my preparation. So today I want to talk a little bit about atherosclerosis. Atherosclerosis as far as heart disease is concerned. Lucy says, good morning, beautiful day in California at my walk, 40 minutes so far. What is the temperature there, Lucy? Let us know. When we talk about atherosclerosis as far as heart disease is concerned, our picture in our mind is plaqued up arteries that are narrowed that block blood flow. And I get it because that is something that has been ingrained in your thought process for many, many, many years, including myself. And I've come to the realization that there is a possibility that that is not true. Sure, arteries get narrowed. Sure, there is plaque. How does it start? And today I want to, 66. That sounds beautiful, Lucy. Today I want to go through and maybe discuss another possibility besides LDL. What is causing our plaque? The LDL lipid heart hypothesis, I believe, has been false for many, many years, yet the propaganda has kept us in that narrow tunnel thinking about this for years. All right? When I think about atherosclerosis now, I think about the anatomy of the artery, and I think about what can cause damage to that anatomy. And you've probably heard me state this before, but the anatomy of the inner lining of an artery, the most inner aspect of an artery, is something called the glycocalyx. It's a gel-like substance. It helps things basically bounce off of it and not get stuck to it, whether it be red blood cells or platelets or LDL or whatever it might be. When something injures that glycocalyx, it now has access to the single cell layer of the artery. It's only one cell layer thick. It's called the endothelium. Hello, Charles. Thanks for being here. I am live on Instagram and YouTube, and I just want to thank everybody for being here. If you are not already subscribed or follow, please click that button. Share it with somebody you think might benefit from what I'm talking about. So when something injures that glycocalyx, the next layer of defense is the endothelium, that one cell layer thick. And not a lot, as much as you think, can penetrate that endothelial layer. Or else, I believe, we would be sick, forever sick. We would have Ebola type things going on all the time. But since God made us with reparative mechanisms, our endothelial cells lining our arteries know that it doesn't want to be injured. The endothelium, the endothelial cell layer, provides great services for us, and it does not want to let you down. Okay? Now, what can damage, in the grand scheme of things, what damages the endothelial lining? What damages that glycocalyx? Because if it starts out with something, some kind of an injury to the glycocalyx, Then we get to atherosclerosis, the ability for plaque to form simply from an injury. Number one, something that can destroy the glycocalyx is an infection. Infections by pathogens. Those pathogens can be bacteria or viruses or fungi or parasites. A pathogen and an infection can damage the glycocalyx. The other thing that can cause damage to the glycocalyx is oxidative stress, something that can cause a reactive oxygen species, an ROS. Now I want to touch on simply the infection aspect. And something I noticed a long time ago when I was at my dentist were like little reading materials on how your dental hygiene can affect your heart health. And I thought, oh, that's brilliant, to have that here. And because people are inclined to want to prevent a heart attack, okay? They want to, at all costs, prevent a heart attack. And I don't believe that they ever thought that their mouth or their dental health or their gum health could be the cause. And I want to reinforce the aspect that your mouth can be this very first seen developing bacteria that can hurt your heart, that can damage the glycocalyx. Your gums are a huge part of what is a nidus for bacteria to grow. And every time you brush your teeth, every time you go to the dentist, you are unseating, because they're seated in there. You're going to unseat them, and they can go into your bloodstream. Okay? Now, I'm not wanting you to not go to the dentist or not brush your teeth. I think actually it's quite the opposite. Okay? I think it's important that we are more cognizant, because even the fact of eating can unseed bacteria and cause them to go into our bloodstream. My point of bringing this up is that, one, we need to pay more attention to our oral cleanliness, okay? Number two, we might need to change what we're consuming, eating, or drinking that could feed the bacteria that do grow. Yes, if you have bacteria in it, you're not going to stop brushing or not stop dental flossing or not stop going to the dentist. That's not the purpose of why I said that. I'm just telling you, if there is bacteria there, they're going to get unseated. If there's, we have viruses or yeast, those things can get unseated, go into our bloodstream, and affect the arteries of our heart by damaging the glycocalyx. Do they damage other areas? Yes. We're talking right now about atherosclerosis in the heart, okay? So when we think about the different pathogens that can grow in our mouth, I want us to think more broadly, and I want us to think about what feeds them. And I'm sure that many of you know, number one is sugar. You've been told by the dentist, if you would just brush your teeth after eating sweets, you would have less cavity-prone mouth, because the sugar is what damages and causes cavities, right? But what about other things? What else do bacteria, viruses, fungi, parasites, what else do they eat? What else can help them grow? I mean, you got the environment, but what can help them grow besides sugar, besides what you put in your body? Could it be heavy metals? Could it be something like iron if you have an overload of iron, a heavy metal, pathogens have been known to survive because they have food. And we overlook, because we've never been told, so we're going to overlook the aspect of iron. We can change our diet. You can change your toothpaste, because do you necessarily want to kill all the bacteria? Do you necessarily want to use an antiseptic in your mouth that kills everything? I say no. What if I tell you that there are some bacteria or some things in our mouth that actually help to release nitric oxide? Well, what does nitric oxide do? Nitric oxide is actually released from endothelial cells inside the arteries of your heart or everywhere else. Endothelial cells, when they're healthy, produce nitric oxide. And nitric oxide is a vasodilator. Oh, that sounds like a really good idea. I want things to vasodilate and get blood flow. Ask any man. They want the endothelial cells to be working and functioning and producing nitric oxide. One of the biggest causes of infertility is ED. Could it be a nitric oxide problem? Yes. Could it be a sugar problem? Yes. Both cause decreased blood flow. So the answer is take a pill. What about taking away the nidus of injury? Because actually the pill won't work as well, or if at all, if there's no nitric oxide. So you're going to take nitric oxide too? Okay, I guess that's an option. But if there is in our mouth production of nitric oxide by bacteria, wouldn't it be a good idea to preserve those and not feed the others? I say yes. It's a good idea. All right. Another thing that, something that I never thought about, I'm going to admit, because I did a lot of reading on this last night to kind of prepare for this, and something that didn't even cross my mind. You know how diabetics or people who are insulin resistant get candidal infections? They'll get fungal infections. They're high risk for having yeast. And I said, okay, yeah, I understand that. And you guys probably do too. But I didn't know that candida can actually swallow up H. pylori. H. pylori is a bug that loves to grow in our stomach and cause havoc. H. pylori loves to cause ulcers in our stomach, and we can get tested for it. You can get a breath test. Like people will have terrible reflux or terrible GERD, or they got this burning sensation in their stomach, and the doctor will check for H. pylori, and lo and behold, it'll be positive. But I never associated the fact that candida can swallow it up in our mouth and bring it down into the GI system and protect it. So the candida, the candida just engulfs the H. pylori, doesn't do anything with it except for protect it, and helps to deliver it into a place where it can cause havoc. I didn't know that. I mean, it's basically an FYI. It's basically a side note. So the thing I want you to understand about pathogens is the pathogens, if they are in our body, viruses, bacteria, fungi, parasites, can actually start destroying the glycocalyx in 24 hours. So you could see if you do something that you do a nidus every single day, you could see where the glycocalyx over time gets destroyed and the endothelial linings is exposed. When that endothelial lining is exposed, guess what? Now there's over and over repair mechanisms that are trying to take place. May or may not occur. If there is constant injury, the endothelial cells cannot repair themselves. You see, the bone marrow, the stem cells, produce little baby endothelial cells. But if they can't keep up, the injury to the endothelial cells forms like a fibrous cap. And underneath that, the clot or the injury is starting to calcify. And over decades, that calcification and then a cap and then calcification and then a cap, they're going on continuously, okay? If there is plaque already there, it acts like a nidus for more plaque. So plaque begets plaque. Okay, and I'm just going over notes. I'm trying to read you guys' notes. Nathaniel says, I wonder how nicotine affects all of these mechanisms. I read something that it increases overall cell proliferation, which doesn't sound good. I believe, and when I start talking about nicotine, I actually want to talk about the oxidative stress part of it. So right now we're basically in the infection part of it, where infection can destroy the glycocalyx, but oxidative stress can also damage the glycocalyx. And one of those things could be smoking. It might not just be nicotine. It could be cannabis. It could be you're burning leaves in your yard. That's smoke. It could be diesel fumes. It could be a house fire. There's so many things that when we breathe them in, it gets into our lungs, and then what gets into our lungs gets into our bloodstream. So we used to think that or we still do, that LDL was the problem. And it could well be. I'm not saying it's not. So if you want to shift gears and you understand that there is a process of infection, that a pathogen, whether it be a bacteria, a virus, a parasite, or a fungus, can be the food or be the injury to the glycocalyx, but they have to be fed. They have to be fed by, like what I mentioned was iron. I just gave two examples. Iron that's in our body now can shift gears and be a form of oxidative stress. Well, okay, how does iron, well, it's a food and it can be oxidized. Just a little bit of water and a little bit of oxygen and you get rusting. So we have rusting going on in our body all the time. When I speak to oxidative stress, I want to elaborate on LDL because that is ingrained in our body about LDL. You see, LDL and HDL are transporters of oxidative equivalents over very, very, very long distances, okay? They're going throughout our entire bloodstream. And HDLs are actually more resistant to oxidation than an LDL. And do I know the answer to that? No. Why an LDL would be more susceptible to oxidation than an HDL? I can try to use logic and say an LDL is much larger. And because it's much larger, something's making it larger. It could be fat and cholesterol and things in the cell membrane, fat and cholesterol. But what if something that it was carrying is something called an omega-6 linoleic acid? It is a fat. It's a polyunsaturated fat. So if certain LDLs have incorporated polyunsaturated fatty acids in the form of omega-6 linoleic acid, meaning you eat a ton or consume a ton of processed foods. You are consuming a lot of omega-6 linoleic acid. Recall that we want an omega-3 to omega-6 ratio of 1:1. We are, in general, the population is consuming a 20:1, 20 omega-6 linoleic acid to 1 omega-3 fatty acid. Omega-3 being, sorry, I apologize for my loud, they'll quit in a second. Hold please. No bark. I don't know if it'll go that far. What could possibly go wrong, Dr. Christie? From what? What do you mean, what could possibly go wrong? When the LDL is picking up and transporting a lot of omega-6, that incorporates that omega-6, that polyunsaturated fatty acid can incorporate itself not only in the cell membrane where it can be oxidized, but it can also incorporate itself through the cell membrane and in the mitochondrial membrane. We need our mitochondria functioning well, but they're being poisoned or disturbed by polyunsaturated omega-6 linoleic acid. Remember, a polyunsaturated fat has many areas where there are double bonds. And wherever there's a double bond is an area where it can be oxidized. There is a transfer of electrons. There is trying to cause a redox reaction, a transfer of electrons to make you feel relieved. But polyunsaturated fatty acids are not something that we want, especially high levels of omega-6. We need the omega-3s, absolutely. And we do need some omega-6s, absolutely. Just not more than a 1:1 ratio. So this LDL gets incorporated, the polyunsaturated fatty acid or iron or whatever it is, okay? Whatever it is can cause a reaction on that LDL. It's injured. The LDL is damaged. It's trying to dump off things to areas in our body where it needs to go, okay? But in the meantime, we are developing small, dense LDLs, maybe from our diet, eating too much carbohydrate causes an increased amount of small, dense LDLs. Even if you don't check the level of small, dense LDLs, meaning you don't get a nuclear magnetic resonance imaging of your blood, you can tell if you have small, dense LDLs. How? By looking at your triglyceride level, and 2, looking at your HDL level. If your triglycerides are more than 1:1 relationship to your HDL, you have more small, dense LDLs. Those small, dense LDLs get oxidized. Oxidized LDLs damage the glycocalyx and the endothelial lining of arteries. The endothelium can't work. The endothelial cells can't produce nitric oxide anymore. The endothelial cells can't keep up with the injury. And then you add in other injuries, like someone mentioned, the smoking, or what about diesel fumes, or what about pollution? Pollution from nanoplastics, pollution from heavy metals, pollution from many things. It's in our environment. Glyphosate. If you live on a farm, you're not, you have risk of getting poisons from the chemicals that are close to you. If you live in New York City, different pollution still there. Maybe finding an in-betweener, a suburban or urban area might be best, but things that are sprayed in the air, sometimes we can't do much about. HDLs, another reason why they're more resistant to, they're more resistant to oxidation is because they actually carry more antioxidants than an LDL. And again, these are things that I'm just learning, okay? And it's something can I prove that this is what's going on? No, But it's something I want to trigger your brain to start looking stuff up and say, hey, why are LDLs more easily oxidized than an HDL? Is there something about an HDL that resists being oxidized like an LDL? Are they less resistant to sugar? Are they less resistant to heavy metals? Are they less resistant to nanoplastics or microplastics? I don't know, but it's worth asking. Dr. Christie says scientists have edited a gene that may reduce high cholesterol permanently. CNN, what could possibly go wrong? That sounds horrific. Well, it sounds horrific to you, Dr. Christie, because you might know that, cholesterol is very important for us. You might know all of the things that, or why we need cholesterol. And you're trying to teach that to people, and it seems like that's a no-brainer. But to a person who's been indoctrinated into LDL is the problem, cholesterol is the problem, they can't see what you see. And you can't imagine. I see that you're still struggling with the how could somebody be so naive? But Dr. Christie, I'm sure I can speak for you because I'm going to speak for myself. I was that naive, and I'm guessing you were as well. You believed in the cholesterol or the lipid heart hypothesis. You believed it because propaganda talked about over and over and over and over again caused dissonance in you. You didn't look anywhere else until you started to look somewhere else. So it took you waking up. And so now your passion is to try to wake up others, to open their eyes. Okay? You know as well as I do that an LDL in the 40s and 50s is not healthy. You know that because there are studies that show that the higher the LDL as you age, the longevity increases. Lower LDL decreases longevity. That again, that is it's something that you need to share and hope that others listen. But in all reality, Dr. Christie, you are an adult. I am an adult, and we have adult listeners here. And we cannot save everybody. We can't save anyone, to be perfectly honest. All we can do is share information, get people to wake up and to start looking. They might prove us wrong, Dr. Christie. They might prove that LDL is the culprit and we should lower it. But I'm telling you right now that an oxidized LDL, whether it be, I'm going to speak in terms of eating a high carbohydrate, especially a processed carbohydrate diet, that it can, those small dense LDLs have been shown in studies to degrade the glycocalyx, that first inner protective layer, that gel-like layer, by 60%. So you can degrade the glycocalyx by 60% in 25 minutes. 25 minutes. So you better be praising the Lord that you have antioxidants on board. But what if you have oxidation on board that's taking up the antioxidants? And, for Christy, this might be where, oh my gosh, no wonder everybody's got iron overload, and no wonder everybody's got insulin resistance, and no wonder everybody's got heart disease. No wonder everybody's getting Parkinson's and dementia and depression and all of these things. Justin says, I can try my best to take care of myself, but our food and environment are working against him. Him. I'm just going to do my best. Perfect. But Justin, you had to first make an acceptance that stuff is in the environment. You accepted the fact, or come to the realization, Justin, that there actually is something in the environment. And now you can say, all right, I'm just going to do the best I can. But imagine the person that does not accept that there is something in the environment that could be causing all of the problems. There isn't anything wrong with the food you eat, because if it was wrong, it would never be on the grocery shelf. They would take it off the shelves. They would take it off so you wouldn't ever eat it. Why would they want to hurt us? That's naive. Okay? That really is naivety. And so, Justin, the fact that you have opened up your eyes, you've accepted that there is environmental toxins, there is pollution, there is something called, that stimulating and oxidizing normal particles in our blood, normal LDLs. LDL is normal, or else why would God have made us with a body, a liver that makes cholesterol in the form of LDL particles, HDL particles, triglyceride That's normal. When it's not normal is when we do stuff to our body, or we allow ourselves to be in an environment that does stuff to our body that causes infections, that causes oxidation. And then we have people called doctors who actually believe, I did at one time, that taking something normal away from you is the right thing to do. Because for those of you who are already, with their eyes open, know that without LDL, you're going to have more problems with infection. You're going to have more pathogens like viruses and bacteria and fungi and parasites. LDL was part of that mechanism to help you. Yet you listen to a doctor that tells you that LDL is the cause and we need to lower it at all costs. Did you ever once ask, doctor, are there a certain type of LDLs that we should get rid of? Well, I don't know, but we're just going to just broad brush paint everything and lower everything. But aren't some LDLs good for you, doctor? I mean, why would God make our body make LDLs if they weren't good? Well, some people just have too many. Well, but doctor, I've heard that is actually good for us as we age. No, it's not. It's the cause of coronary artery disease. But doctor, if it is the cause of coronary artery disease, why do people who have low LDL still have heart attacks? Well, they're just unlucky. Do you see how their defense just falls apart when you start asking questions? You might not know the answer, but you know what question to ask. And so, cholesterol is good for you and it does not cause heart attacks. I agree, Gloria. Dean says, my LDL is high, but my triglycerides are okay. 5.1 score. They are good LDLs. Okay, I don't know what your triglycerides are, and I don't have a calculator to tell me what 5.1 is in America as far as your LDL or if that was your triglyceride. I'm sorry, I don't have that calculation. So if you want to do it to a calculation to the US, I would appreciate that. And then I can maybe answer your question, but I don't know what okay triglycerides are. I don't know your HDL either. So I don't know the conversion from, I'm guessing, Europe into America, because I don't have a calculator for that. Sherry says, our bodies actually make cholesterol. How can it be bad for us? Again, I would agree. There are times, just hear me out. I want to just throw a caveat to Sherry. There are times when our body makes a type of cholesterol, a type of LDL, and we as doctors call this familial high cholesterolemia, high cholesterol in the blood, and we give it the familial descriptor. That gets people in an awkward position because now they'll say, oh, well, my dad had high cholesterol and his dad had I got familial high cholesterol. And everybody who has this family history, you better be on a statin or some Repatha or, PCSK9 inhibitors, whatever the medicine is, okay? They've gotten us brainwashed again because familial hypercholesterolemia is a genetic disorder. And in order to diagnose it, the doctor should do a genetic test on you. Does insurance pay for it? No. So they're just going to say, well, you know what? You probably just have it. But in essence, having high cholesterol, or LDL for that matter, is not the problem. It's the LDLs in familial hypercholesterolemia that are pleomorphic. They do more than what they're supposed to do. In other words, they have a tendency to increase blood clot formation. That is the problem with the LDLs in actual familial hypercholesterolemia. If they're just familial hypercholesterolemia, genetic disorder, and have none of that clotting problems, guess what happens to the familial hypercholesterolemic patient as far as longevity is concerned? You guessed it. They live longer. They live longer because of their high LDL and cholesterol. Okay? It's the people with familial hypercholesterolemia that has a little component that's different, that increases the risk of blood clots. Those are the people that have heart attacks. Not because the LDL that they have got stuck in the arteries. Can't happen. It can't happen. They're too big. The molecule and the lipoprotein of an LDL is too big. It can't penetrate the glycocalyx, and it cannot penetrate the endothelial cells. The endothelial cells might let in a 0.25 nanometer object, not a 25 nanometer object such as an LDL. So the LDL did not cause the injury. Something else caused the injury. Picture this, and I don't know the answer. What if the pleomorphic, the clot-forming familial hypercholesterolemic patient never had an injury? Never had an injury. They could live with that clot-forming LDL forever and never have a heart attack because they never made the injury. What causes the injury? I told you that it could be sugar. It could be nutritional deficiencies. It could be infections. It could be oxidative stress. It could be heavy metals. It could be nanoplastics. Everything that's in our environment and the pollution of things. It could be polyunsaturated fatty acids. When someone starts reducing an injury to the lining causing a plaque to one thing, I start wondering, what are they trying to sell? Okay? If somebody says it's all LDL, what do they got to sell us? They got to sell us a statin or a PCSK9 inhibitor. They got to get your LDL down. 111 says heart attacks can actually have a lot of causes. I think the main cause, 111, is a blood clot. Okay? But when we reduce an injury, let's go down even further, 111, instead of just ending with the heart attack as the outcome and what causes the heart attack, let's go down to what causes the injury in the lining that causes a blood clot, that causes plaque formation, a Band-Aid, a fibrous cap that can get broken off and go downstream and cause a stroke or a heart attack. We have to get to the nuts and bolts. Is it just glucose? I would never reduce it down. At one time, I thought it's possible that just glucose being elevated, causing insulin resistance, could be the cause, is the cause, the only cause, possibly. It's not. Yes, it's a major cause. Having insulin resistance is a major cause of coronary artery disease. They tell you that. If you ask a cardiologist, what's the number one cause of heart disease, of a heart attack? They'll say diabetes. Most of them will say diabetes. And you say, are you helping the diabetes? Oh no, we got to lower their LDL. I mean, where's the thinking? LDL is not even in, when we talk about, I talked about metabolic syndrome yesterday. Metabolic syndrome, 5 different things going on. You only have to have one of those to be at high risk for a heart attack. But yet we put them into a 5 thing. High blood pressure, high blood sugar, high triglycerides, low HDL, and high waist size, a big waist. Where was LDL in that description of metabolic syndrome? Nowhere. Is it irrelevant? I don't know. I don't think so, because I think the LDLs that get oxidized by those things is a problem. The small oxidized LDLs are sticky and yucky, and they can get involved in plaque formation. So are we wrong in saying that LDL is a problem? I think so. LDL is a problem, but not all LDL. You don't just lower it to 40 like Lucy said or Christy said, because we need LDL. We're just causing the wrong kind to form and cause problems in us, oxidation. So sugar's not the only cause. Iron overload is not the only cause. Polyunsaturated fatty acids are not the only cause. Nanoplastics, not the only cause. Some other pollution and smoke in the air, not the only cause. Do not be a reductionist. Start wondering, what are they trying to sell you? If you got diabetes and they tell it's all sugar, they got a diabetes medicine for you. If they tell you it's overload of iron, they got a medicine for you. If they tell you it's pollution, they're going to give you a filter for you. They're trying to sell you something. I'm not saying that you can't treat all of those things. Make your environment cozy. Get a filter, get a this, get a that, protect the water from going into your body by reverse osmosis. I'm not telling you that some of those things are not worth purchasing. I'm just telling you to use common sense. If somebody tells you that you're low on antioxidants, do you go just taking antioxidants like a bunch of vitamin C? I say no. Why is your vitamin C low? Well, your vitamin C low could be low because you're eating a bunch of carbohydrates. Carbohydrates block the absorption of vitamin C. You have nutrient deficiencies. Okay, why is that? Well, you could be eating a bunch of plants. Plants have oxalates and phytates. Hold, please. No bark. No bark. Didn't work. Okay, so phytates and oxalates prevent the absorption of nutrients, calcium and magnesium and selenium and zinc and amino acids and B vitamins. So do you just go take all of the things I just mentioned so you can eat plants? The plants... Something simple as that worked. Okay, so usually I have a little noisemaker. This is Tallow. You can't see him, but he just came up and he wanted to apologize for being quiet. He's a good boy, my little Tallow. You're a good boy. You go lay down, okay? Go lay down. Go lay down. Okay, go lay down. Thank you. Okay, so the diet that we're eating can decrease the absorption and we get nutrient deficiencies. The things that we are eating that give us polyunsaturated fatty acids, or in this case, I know Dr. Christie would love to hear about this, is when we eat processed foods, we are eating all synthetic stuff. It's all made in a lab. Nothing is natural. Not the iron, not the vitamins and minerals, none of it. It's synthetic. We are incorporating that in our body and we really can't absorb it. We can't use it. So it gets trapped in our organs. Again, I understand. You're hearing me and you go, oh my, woe is me. Like, how do I live then? I'm just bringing up these things so it's opening your brain to start understanding that there are a lot of stuff, okay? Just like Justin said, there's a lot of stuff going on in our environment. We cannot live in a bubble. But that doesn't mean that we live in this bliss where, you know what, I'm going to die anyway. I'm going to eat my processed foods. I don't care if I get iron overload. I don't care if I drink tap water and I get fluoride and it blocks the absorption of iodine and then I get thyroid. But I'll just take a medicine for my thyroid. If I get heart failure, I'll just take a medicine for my heart failure. If my eyes start going bad with macular degeneration and cataracts, they got these fancy new surgeries. I'll just get a new lens. If that is the way you want to live, then, and you can feel good about it, I can't not support your wishes because you are an adult, okay? But if you're someone who's listening and say, oh, well, I didn't know that tap water was full of fluoride. I guess I could go check my city and see how much parts per million they're putting in there. That seems easy. If I could just get a little Brita filter and it'll filter out some of the stuff, that seems like an easy fix. I didn't know that the little plug-in things that go into my outlets that give the smelly things block my hormones. Well, that's a simple fix. Just don't put them in there. Oh, I didn't know that you could buy certain filters and put in your furnace that could help block some particulate matter. Well, that's an easy fix. It was just $10 more than the other ones I was using. Lay down. So just these little things that you can do. If you know that polyunsaturated fatty acids are present in processed foods, then just stop them. I don't want those polyunsaturated fatty acids that can get oxidized and incorporated into my LDLs, and then the LDLs that get oxidized are the ones that cause heart attacks. So there are things you can do, but you can't change the air you breathe. You could, there was one guy I listened to, he said, and another listener sent this to me, that if you get exposed, let's say to chemtrails, or you went to a bonfire, and you were breathing in all kinds of smoke, the way to detox immediately is to go sweat, get in a sauna, start working out, like within 24 hours of exposure. If you sweat, you could get some of the parts per million out of your body. I mean, again, that seems like a no-brainer. I mean, some people have little saunas, the little tents that they put in their house, and they can do a little tent. I'm going to skip through the YouTubers and go all the way to the bottom. So if you had a genuine question on YouTube, ask again, because I just went to the end, because there's a lot of riffraff in between that I can't keep up with. Dean says, I'm from the UK. Do you know any alternatives for blood thinners, for heart stents, and recent TIA here? I eat clean too. I don't know what clean is. Does that mean you wash your food off with soap and water? I don't know what that means. But once was overweight, 13 stones. I don't know how many pounds that is in America, okay? I walk a lot and I cycle. Your walking and your cycling could be a problem for your heart. It's raising mTOR. mTOR at times is really, really good, but when you're doing it all the time, not so good. It also increases cortisol. Cortisol we need. Cortisol in high amounts we don't want. So, to answer Dean's question, if I just answered, do I know of an alternative for a blood thinner? I would say nattokinase. There was the answer. But all of the other stuff that you're giving me, I don't know how to interpret. I'm sorry to hear that, Ozzy, about one, your back, and two, the GPs that you met in your life. I apologize for my comrades if they have done you a disservice. HP says, passive sweating is more effective than workout sweating. So you're saying a sauna is more effective than a workout sweat? Okay, you guys, that's what HP is letting us know. I'm guessing that's what he means by passive sweating, is that you're just sweating like doing nothing. Maybe sitting in the sun, going in a sauna, don't do anything, not exerting yourself might be a better way to effectively detox than sweating in a workout. This is a question I don't know, but I can briefly just touch on. There's a question, where does your anion gap fit into this? When when we can tell whether or not our body is acidic or alkaline, we know what loves to grow in an alkaline environment. Pathogens love to grow in an alkaline environment, and that can be a problem. When we look at our CO2 on our metabolic profile, we like to see that CO2 between 24 and 26. Do I look at the anion gap as much as I look at the CO2? No, I don't. Maybe that is a flaw and I need to look more into the anion gap. But right now, my hyper focus is on CO2, and I'm not trying to be a reductionist. I'm telling you what I know. I know CO2. And I can look at your blood cell count, and I can incorporate that CO2 into how big is your cell? How much color is in the cell? How many red blood cells might you have? Everything kind of filters back to the health of your red blood cell, to be perfectly honest, okay? And a healthy red blood cell makes for a healthy white blood cell, your immune system. When our body is under a bunch of stress, or we have a lot of chemicals in our body, or we have a lot of oxidative stuff going on, everything is being damaged. We're inflamed. We get, what other words do we use for this type of what's going on? They're just buzzwords that we really don't know how to explain, okay? We can do the normal things. Like if how do I say this? If I wanted to give you some things that you need to be on the lookout for, or what are my strategies? There we go. What strategies can I help you maintain that could improve your health, or maintain health, or prevent a nidus to be unhealthy? One, I would say, without hands down, is your diet. Control glucose. Insulin resistance increases our risk of infection and oxidative stress. Insulin resistance. Now, what causes insulin resistance? Many things. Is it just glucose? No, I've told you. It could be PUFAs, omega-6. It could be iron. It could be nanoplastics. It could be other heavy metals, iron overload. Lots of things can cause insulin resistance. So I'm using this generally. Insulin resistance increases infection. Viruses, bacteria, fungi, parasites. Insulin resistance also increases oxidative stress, i.e. our LDLs getting oxidized, causing small, dense LDLs. Small, dense LDLs cause heart disease. They're sticky and gooey and yucky, and they join with the platelets and the white blood cells, and they just form a nice little plaque. And then a plaque begets a plaque over years. The thing that causes a heart attack is not the plaque and the plaque and the plaque. It's the fibrous cap that breaks off, floats on downstream, and causes a heart attack. Most people, and I give you this by personal experience, my dad had 5 vessels blocked. He had no symptoms, no angina, no nothing. Why? Because he developed collateral flow. Had he had angina, chest pain, he would have gone and got tests. He would have gotten an echo. He would have gotten an angiogram, and they would have said, oh my goodness, you have 5 vessel coronary disease, and they take you to the OR immediately. But what my dad had was symptoms from maybe lack of blood flow, maybe his exertion of running years and years and years. He got congestive heart failure. He got AFib. He got the things that damaged not just the plumbing, but the electrical system. His plumbing was not causing his symptoms. The electrical system was. And we do so many things because they told us it was healthy. You go be a jogger, be a marathoner, go walk. They never told you to lift weights. They never told you to do high intensity interval training. They didn't tell you those things. And in fact, really, did they tell you anything? Here's what they said. You need to exercise more, be active. and you need to just really eat less. And then you'll solve all your problems. Not true. That's what caused all your problems. That's what's still causing all of your problems. So insulin resistance increases the risk of infection and increases oxidative stress, i.e. it oxidizes LDLs or small dense LDLs to cause a problem. How can we tell if we got oxidative stress? Look at your triglyceride level. If it's greater than 70, you have a problem. If your HDL is less than 70, you have a problem. And when those two are in combination, you have a triglyceride level above 70 and an HDL below 70, because really, when triglycerides go up, HDL has to go down. They go together. High triglycerides, low HDL. Low triglycerides, high HDL. If you have a ratio greater than 1 of triglycerides to HDL, you have oxidative stress. I can guarantee you have small, dense LDLs going on in your body. I can almost guarantee that your insulin level is above 5 or 6. You have insulin resistance. What can you do? I know I keep getting to this and I name one and then I go off kilter. What can you do? Control your glucose. First and foremost, your diet. Decrease your carbs and decrease polyunsaturated fatty acids that you obtain in processed foods or ultra-processed foods. Stop eating things that come in a box or a bag. They're fake. They're man-made. They are fake. They have fake things in them that are causing more and more problems. You look at them as, oh, they're just fortified. Fortified, the other name for that is fake. Okay. Number 2, treat your nutritional deficiencies. You have nutritional deficiencies because you eat fake food. And there are fake nutrients in it that can never keep up with your nutrition. There's no amino acids. There's no B vitamins that you can absorb. You can't even absorb them now because you're eating fake food that blocks the absorption. So even if it's fortified, you're probably not getting it in there. And what you are getting in there is fake. So eat real food. But doctor, you just told me that plants cause the problem. I did say that. All plants, but especially fake plants. Fake that you took an oat and you made it into oatmeal. That's really wrong. But they told you it was good for you. It'll lower your cholesterol. Your cholesterol's not the problem. Your small dense LDLs might be the problem. Your insulin resistance might be the problem. Your iron overload might be the problem. Well, how did I get that? You ate oatmeal every morning for 30 years. And you ate potato chips. And you ate broccoli and kale and spinach and all of this crap that increased non-heme iron. Well, you're getting that in the fake food too. It's on and on and on, accumulation of all of these things. So what do we eat, doctor? Well, I mean, to be perfectly honest, the things that you should eat is things that come from an animal. An animal at least is going to filter. Do I choose certain animals? Absolutely. I choose ruminant animals because they have multi-chambered stomachs. So I'm going to lean more toward a ruminant animal and consume that and not have nutritional deficiencies. I might eat a little liver. I might eat a little of organ meat. But I'm going to avoid plants, consuming them in my mouth. I'll consume plants as long as they're filtered through a cow or a deer or a lamb or sheep or bison or buffalo or something like that. But you're grown adults. And I'm not expecting you to eat what I eat. And could I die tomorrow? Absolutely, I could die tomorrow. I could fall off the curb, get hit by a car. I could get shot in the head. I could eat sorrel soup at my local Chinese place and die of oxalate toxicity right there on the spot. There's a lot of things. But in the meantime, I'm going to practice all the things that I have a capacity to change. I'm not going to drink tap water. I'm going to put a different filter on my furnace. I'm not going to use plugins that destroy my hormones. I'm not going to drink alcohol. I'm not going to smoke. I'm not going to go to places that do that because I will be taking it in. Do I live in a bubble? No, I'm just cautious. If you want to fly by the seat of your pants, go for it. I'm not telling you what to do. Okay? It's hard to hear these things But hey, so I mentioned for treatment-wise, control your diet, control glucose, control nutritional deficiencies, okay? Tyler really wants, he probably wants to sit in my lap, and he's kind of a big dog, and he would take up the whole screen. He's not really that big. He's only 15 pounds, but he's bigger than my other two. Okay, so oh my goodness. Oopsie. Okay. Now we got Timber. Okay, all right. Now, treat nutritional deficiencies. I just went through that. Next on the list, treat infections. Remember how I started this whole thing with your oral mucosa? We have infections in places we don't know about, okay? And so if we don't take care of our oral health, or we overdo it, let's say we overdo it with antiseptics, we're causing problems, okay? What should we use instead? Maybe just washing it out with warm water. Wash your mouth out with warm water. Maybe you're gonna use a hydroxyapatite toothpaste and not a fluoride toothpaste. Well, what's so bad about fluoride? Well, fluoride is actually an antiseptic. That's why they put fluoride in our toothpaste or fluoride in our mouthwashes. It's an antiseptic. That's why they put it in our water. But they didn't tell you all the harms fluoride does. Like it gets stuck in our brain and causes cognitive decline, that it blocks our iodine absorption and then causes goiter. They don't tell you those things. They're just gonna keep it so minimal. But the accumulation, they don't take into consideration. And you know what they're gonna call it? Normal aging. As if you're supposed to have goiter and heart disease and high blood pressure and swelling of your feet and damage to your skin. They're gonna tell you all of these things. That's normal aging. Is it? Is it really normal aging? Are we supposed to get diseases as we age? I really don't think that's in the cards. But we are brainwashed to think that. Your joints are just gonna go bad. Your skin's just gonna go bad. Your organs are gonna go bad. Your eyeballs are gonna go bad. And then they give you all these fancy treatments, like new eyeballs and plastic surgery and liver transplants, kidney transplants, dialysis, all of the fancy things. They make a diagnosis, they give you a diagnosis, and then they give you the treatment. And they never once told you, gosh, you have goiter because you overconsume fluoride. Why don't you just remove the fluoride? Why don't we give you a little iodine for a while to build that back up? Why don't you just eat some iodized salt? Well, they told me not to eat salt. Not that iodized salt is the answer. It's not, because once air exposed to that crappy salt, yeah, it's gone. Iodized salt is dumb. Did it help at one time when people were in the goiter belt? Yeah, but it is not the treatment. If you have really, really bad goiter and you take any form of iodized salt, it's probably gonna get better. I'm just saying it's a crappy choice. You could choose another way. Okay, so treat infections wherever they might be. I don't know where they're at, but they're there probably. You probably have a candidal infection if you have glucose intoxication, okay? You probably have parasites that are living rent-free in your body, and viruses and bacteria. How do you treat them? That's a good question, because I don't think that just antibiotics are the answer, because you have to stop what's feeding them. I believe if you take away things that don't feed them, what do they eat? What do they eat? Iron. Well, I'm gonna stop non-heme iron from all plants and synthetic crap. Okay, done deal. I'm not gonna give them sugar. They love sugar. I'm not gonna feed them. They'll just die. I don't need to give them an antiparasitic like ivermectin. I don't need to do it. Do I have them on hand? Absolutely. Sometimes you just need that. But treating infections, okay? Next, check for clotting diseases. If clots are a cause of coronary artery disease, find out if you have a clot disorder. two of the most common clot disorders, factor V, right? Factor V and prothrombin mutation. The two most common. Doctors never check for it. Unless, of course, you actually get a clot and they'll go, hey, maybe we should check you for factor V, but may not even know about prothrombin mutation. You check them both, prothrombin mutation and factor V. So check for clotting disorders. Could you be that pleomorphic familial hypercholesterolemic patient? Yes. But remember, clots form at areas of injury. Stop the injury. If I don't want to get a clot scab formed on my skin, working with debris out in my yard, I'm going to wear gloves. I'm not going to let a cut occur. We can't prevent everything. I get it. But I'm not going to smoke, which causes daily damage. I'm not going to drink alcohol. I'm not going to eat sugar. I'm not going to consume polyunsaturated fatty acids. Do you see where I'm going with this? Avoid what causes the injury. I can know all about my clot factors, but they might never be a problem until I have an injury. Now, wheels are off the bus. It's nice to know if you have a clot injury, especially if you're a male and you want to do some hormone replacement and you decide to start some testosterone. Guess what? Testosterone increases your hematocrit. It's going to thicken your blood. And then you have a clot disorder like factor V or prothrombin or both, you are at risk of getting a blood clot, a stroke, a heart attack. Do you want to take that risk? Do you think hormone replacement doctors are checking you for factor V and prothrombin mutation? Doubtful. Doubtful. Do you think that your hormone replacement doctors are checking for iron overload? Doubtful. They want to treat you, get your testosterone number to where they want it to go, and have you tell all of your buddies, go to this place, they give you testosterone. You feel amazing until you don't. You get heart failure, you have a stroke or a heart attack, and you think it's just normal aging. Okay. Number 5. I went ad nauseum, I went through this, but avoid toxic environments. Your water, the microplastics, your skincare. You can accuse me of this. Anything you put on your skin, it could be a toxin, might be a toxin, and that can damage things. Your lotions, your slow aging creams, I'm going to slow down my aging. You are going to age. There's no such thing as an anti-age. You are just going to slow it down. Are you willing to take that risk of those toxins going through your skin, even your lotion? You could put tallow, not my tallow, but you could put tallow on your skin, okay? You could rub your skin with butter. It doesn't seem too appetizing to put some animal fat on your body, especially if you have dogs. I've tried it. I used to use tallow, and then I find that my dogs lick it all off my skin. You can't put it on your face, so they're going to lick your face till it's gone. Okay. Your toothpaste, I mentioned that. We mentioned the filters on your water, filters on your humidifier or your furnace. I know I'm probably missing stuff, but I think you guys are getting the idea. Miss Young says, can you discuss regression of plaques? My CAC score was 13 in one structure. So one of your arteries, I'm guessing, the LAD, the RCA, the circumflex, one of them had a score of 13 and likely a 0 in all others. To be perfectly honest, when one artery is showing all of it, that's probably worse than if you had it scattered throughout. I'm not telling you it's a bad score, but it's over 0, right? 0 for a CAC score is normal. Is it possible to get plaque regression? I do believe. I think that your body can help plaque regression, but you have to stop the things that caused it to form. Remember, plaque begets plaque. but I have heard anecdotal ways that people went carnivore or they got rid of iron overload and their CAC score, and they got rid of the pathogens, the infections, and they got rid of their risk for blood clots, and then the plaque started to regress. I have seen it. But maybe, Miss Young, if you check your score, you want to get a progressive CAC score and you want to see where it's at, and you go, maybe I want to do 2 or 3 years instead of when they recommend 5 years. So for $100, you go get some radiation on your heart, your body, and your score in 2 years or 3 years is 13. You should pat yourself on the back because normal aging causes plaque to progress. And yours stayed at 13. You controlled your glucose and your polyunsaturated fatty acids. You treated your nutritional deficiencies. You stopped eating plants and you started eating more animal products. You treated your infections. You got better at oral hygiene. You checked for your clotting diseases. You have none, or you have some. And maybe, just maybe, you decide you're going to take nattokinase and you avoid a toxic environment. And your CAC score in 3 years is 13. Congratulate yourself. That's amazing. Don't say, doctor, do you think I need a statin? Or your doctor says, Miss Young, I think you need a statin. Why, doctor? I'm at 13. It stayed the same. I'm not getting any plaque. If I take a statin, don't statins increase plaque formation, doctor? Don't statins decrease my ability to control my blood sugars, doctor? And isn't uncontrolled blood sugars lead to diabetes? And didn't you once tell me that diabetes was the #1 cause of heart disease? I wonder what that doctor would do. When you start, I hate to say, if you start like poking your ice pick into them and saying, is their ego so strong that they're going to say, you know what? I don't think that your ideal and my ideal, I really think you should find a new doctor because our thinking just doesn't correlate. It doesn't match. I really think that you should find a new doctor. Or they're going to say, wow, Miss Young, I didn't think of those things. And since we're in a partnership together to help you with your health care, I promise to you that I'm going to go read about these things. And I have to admit, I don't know it all. Could you even imagine a doctor doing that? But maybe there's one out there. Maybe they're wearing a Dodger cap right now. Maybe they're talking to you for free right now. Patients have a tendency to, if they're persistent, can help their doctor. I've had several who have helped my doctor, or helped me be a better doctor. Again, on YouTube, I went to the very end because all the riffraff in between. Gloria says doctors get paid to prescribe vaccines and meds. Okay, let me explain this to you, Gloria. If I write for a medication, I do not get paid from the pharmacy or the maker of that medicine. I do not get paid. Now, if I wrote the medicine or I'm a speaker for the company that makes the medicine, now I'm getting paid. I can get paid by an insurance company. I can get paid from an insurance company to maintain adequate treatment that they deem correct. Let me say this. If they tell me that LDL at 100 is the goal for everybody in your practice, and if they're not at goal, you should put them on a statin. Now, if I meet that criteria of putting everybody on an LDL medicine that gets them to goal, a blood pressure medicine that gets them to goal, a diabetes medicine that gets them to goal, now I'm getting paid to do a good job. They say that is doing a good job, and here's your bonus. That is getting paid to prescribe medicines in a roundabout, not directly, indirectly. Now, vaccines. If I give you a vaccine, Gloria, I have to pay for the vaccine. I go buy the vaccine, a bottle of them, and it has 10 doses in it. I charge Gloria and 9 other people a fee. If I buy one dose for $10, I'm going to sell it to 10 people for $30. So instead of a dose for $10, I got 10 people in here. I'm going to sell it for $30. So I'm going to buy the bottle for $100 and make $300. That's how I get paid. Plus, I can get paid by injecting it into you. I get an injection fee from the insurance company. They will pay me to give you the vaccine. Okay, they're going to reimburse me the $30. I only paid $10, but they're going to reimburse me $30. You paid for insurance to allow them to pay me. Make sense? So I, out of that one bottle, can make $300. So it incentivizes me to have that vaccine, or whatever it is, B12 or whatever it is, to have that on hand. Because the more I give it, the less people I really need to see. I can make all of my money by giving people vaccines, i.e. pediatricians. Okay? That is how we're compensated. I get paid in an injection fee. I'm going to charge Gloria $65 for me to push the syringe into her muscle. The insurance company might pay me $30, but it's $30 I didn't have, and it took me 3 seconds. Make sense? So Gloria, in your head, you might have heard that we are just paid by whoever because it doesn't work that way. Nobody's sitting back and writing a doctor a check to say, ooh, if you write my medicine, I'm going to give you $10. I'll be in tomorrow. You write Jardiance, doctor, and I'll be in tomorrow and I'll write you a $10 check. No. Now, if I worked for Jardiance and I went and spoke to a bunch of doctors and they paid me $1,000 for an hour to talk to other doctors about Jardiance, that's getting paid by the pharma companies. That is legal. That is legal. There's taxes to be paid. There's everything. But legality and inflaming my brain, and do you not think that if I was getting paid $1,000 an hour to talk to a bunch of doctors about Jardiance, that I'm not going to be incentivized to write Jardiance? Do you not think that if a drug rep comes in and love bombs me with sodas and coffee and you're so great, doctor, and you're so cute, and I love what you're wearing today, and from what I see, you're like amazing. You just know this all like the back of your hand. I wish all my doctors could be just like you. Do you not think that is going to influence our little tiny brains and get us to write that medicine? Now, you would hope, Gloria, that your doctor has some sort of scruples and morals and ethics and aren't just going to write you Jardiance for the heck of it. You would hope that. But you can't trust anyone, really. So what do? You got to go read about it yourself. And you got to say, okay, what was the reason I need Jardiance? Well, I got heart failure. Why did I get heart failure? Oh, I got diabetes. Well, why do you have diabetes? I have carbohydrate toxicity. Then stop the carbohydrates. You have to educate. You are an adult. If somebody told you, I know this, if somebody told you to go jump in front of a train, would you do it? If somebody told you to jump off a cliff, would you do it? If somebody tells you to take Jardiance, do you just do it? Or do you say, hey, let me look into this? I need to know the ins and outs. I might have to go to social media doctors. I mean, imagine that. You mean the ones working for free? Yep, those. Hopefully they don't have anything to sell. Remember, know why you're doing something. If you know that eating a processed food is going to cause you to get diabetes, that is your freedom of choice. I think I'll just eat the processed food. I don't care if I get diabetes. There's Jardiance. There's metformin. Who cares if metformin ruins my mitochondria inside my cells? I mean, who cares? I don't need those mitochondria. I don't need any energy. I'm dying anyway. I'm getting older. I want to sit. I want to play video games. I just want to watch whatever soap opera is on. Shh. Okay. Doctors get kickbacks for forcing statins. They don't. They don't. It's not a kickback. You guys, it's a policy. It's a guideline. Insurance companies and USDAs and FDAs and CDCs, they set guidelines, and doctors follow guidelines. And for following the guidelines, they get bonuses, or they get incentives, or they get paid the fee for service, the fee for doing something. Like if I charge $65, they're going to pay me $25. They're going to pay the compliant, follow guidelines doctor $65. And so that tells me, when I find out that all the other doctors are getting paid more, what am I doing wrong? Well, you're not following their guidelines. Follow their guidelines, you get paid more. It's not a kickback. It's propaganda. It's bamboozled and buffoonery. It's amazing how they affect our minds. We've been mind-boggled. Even when you find out and your eyes are opened, you still can't believe that you've been so naive. You can't believe it. When you guys start opening your minds and your eyes, you won't believe what you start seeing. You won't believe it. Gloria says they wear white coats for a reason. Well, they've kind of stopped doing that because it actually caused more problems. It caused stress and anxiety, and it prevented them from actually opening up to the doctor. So many doctors stopped wearing them. It increased their blood pressure. It increased their anxiety. It got them, it's not a comfort, actually. It's actually the opposite. And so, yes, I could see in a hospital, the security of being in a hospital and seeing the doctor walk in with the white coat, I can see that. But in an office, quite the opposite. Yeah, Gloria, some doctors get paid. It's only the ones that are actually working. They're on the payroll. I don't know who this is, but they said medicine does not fix the problem. The correct food, exercise. What medicine does, it actually treats a symptom. What the symptom is, what is the symptom of? That is where you need to look. What is causing the symptom? High blood pressure is not a disease. It is a symptom of something else. High insulin resistance, diabetes. But you've been diagnosed, and they'll give you that diagnosis. And the insurance company will raise your rates, right? This is all a game. I got a medicine that treats your disease. And I've been told that if you get high blood pressure, 140/90 or 135/85, I have been instructed to follow guidelines because I don't want to get sued, and I put you on a blood pressure medicine. When in fact, when I lower your blood pressure, I'm actually, in essence, slowing down blood flow to all of your organs, even your brain. If I lower your pressure, it was up because your heart knew that, oh my gosh, the brain's not getting any blood. I got to increase pressure. I got to push harder. I got to do these things. And now the doctor comes in and lowers your blood pressure. And then you wonder why you're getting foggy brain. Well, you're not getting any oxygen up there. What was the problem? Oh, I have insulin resistance. I have hyperinsulinemia. I have to lower my carbs. I have to go to 0. Then my insulin will come down. And then my water retention will come down. Then my salt retention will come down. And lo and behold, my blood pressure is normal. Okay, Judy says, I mean, I'm having a hard time reading this. I went to a nurse practitioner last week. She thinks she is a few steps above God. Above God. Whoa, that is a problem. A few steps above God. I mean, how high? Really, you can higher? She can go higher than God. So I'm 72 years old, and she looked at me like she did not care what my problem is. I just found out that I have alpha-gal. Okay, so you have some sort of intolerance to red meat. I would venture to guess, Judy, that if you cleaned yourself up, get rid of your sugars and your polyunsaturated fatty acids and all of the infections and all of the clotting problems and all of the nutritional deficiencies, and you ate fish and chicken and other poultry and pork for 3 to 6 months, your alpha-gal would be gone. Okay? Somewhere along the line, you have a resistance to the galactose in red meat. Is it a death sentence? I think not. But the fact is, where I stumbled is not with your alpha-gal. Where I stumbled with is you felt like you were nothing in the presence of somebody who thought they were everything. And when that happens, when you are belittled or felt to be belittled in the presence of somebody who is acting superior to you, then that is an instance where you need to remove yourself. That is a person who is never really ever, probably ever, never going to see eye to eye with you. They're not a partner in your healthcare. They are paternalistic, my way or the highway. If she looks at you at like you're dumb or did not care, she is one claiming, she's just basically saying, I don't know what you're talking about, but I'm not going to admit that to you, right? I'm 3 steps above God. So do you think that she is ever going to admit that she does not know something? I think it's so easy. If you brought this to my attention and I go, oh my gosh, I don't think I know anything about that. Tell me about it. Let's work on this together. Let's go look at something and see what we need to test. Do we get some sort of an antibody for alpha-gal? Oh, yeah, there is. Do you want to check? Yes, let's do it. Thanks, doctor. This has been great. But no, she belittled you, made you feel inferior, and now you're going to hold on to that. And do you think that that's going to look good when you come to Dr. Jensen in another office and you're going to have in your eyes, oh, what's this one going to bring? Now she's going to be 5 steps above God. See how it just, and now does it make you want to go to the doctor? 72-year-old Judy? Likely not. Now that could be a good thing, and you shouldn't go to the doctor. You should probably avoid them because you're running into the nurse practitioners like this who make you feel inferior. But you guys, these are all dynamics. This is psychological dynamics that are very difficult for me. I mean, I've wanted to be bamboozled by the most psychological things that have occurred, and I can't even believe it. I mean, just think, I was psychologically managed and deceived by medical school. I paid $100,000 to be indoctrinated in medical school. I paid another $50,000 to be indoctrinated in undergrad, just so I could go to medical school to get indoctrinated. And then I got out, and every continuing medical education, I was indoctrinated again. And then you have people in your life that do the exact same thing. They'll indoctrinate you because we have let down our guard. We're no longer discerning. We trust everybody. We believe everything everybody says. I don't want you to believe everything I say. In fact, go poke holes in my thing and then come back and say, Dr. Jensen, you mentioned something about HDL and not being resistant to oxidation and blah, blah, blah. I went and looked it up. Here's what I found. You're either right or you're wrong. Well, did you look it up in 15 different places? Oh, I'm glad you brought this up. Let's go look at it together. You look this up, I'll look this up, and let's come back. We don't know it all. No one knows it all. They might pretend to know it all, like the 3 steps above God lady, she said nurse practitioner, I'm guessing. Oh, she is a nurse practitioner who made you feel like shit. Crap, Ola. Just because you brought up something that she might not know about or doesn't have any interest in treating you. You're 72 years old. You're just going to die anyway. I'm just here to give you your medicines and try to prolong your happiness in life. And you're just going to go. She's probably like 35 years old. She might even be 40. She might be 50. She might be feeling her own demise and thinking that she's superior to you because you're 72. No diabetic medicine solves diabetes. Diet does. I agree. The medicines only make it worse, especially when you start adding insulin giving insulin to a person who's already hyperinsulinemic. They already have a high insulin level. So I got an alcoholic, I'm going to give them alcohol for the treatment. They're already hyperinsulinemic, so I'm just going to give them more insulin. That's going to fix it? No. Okay, I'm going to skip all of this stuff again. So if you have an important question, wait a second. No, I went to the end. So if you guys have another question, there was so much in there that I can't keep up. A lot of riffraff. All right. How many questions did I miss? Melanie says, what can be done if clotting disorders? One, you want to know what they are, like what is your diagnosis if you have a clotting disorder? Sometimes when people, doctors, if you got factor 5, they might say, hey, if you travel, wear compression socks. Or you might say, maybe I'll take some nattokinase. Maybe you'll take 1 a day, 2,000 FUs or 4,000. I would look more into it. Miss Young says, by the way, I practice carnivore and don't plan to stop. Good for you. It doesn't look like I missed a whole lot on Instagram. That's good. Sheila and Suze, thank you for joining. I appreciate it. Do you guys have any other questions? Oof, here's a tough question. Maybe not. Melanie asks, does transdermal hormone replacement increase clotting risk? I don't know what is in your hormone replacement, but I do know this. Your hormone replacement is synthetic. You were given a hormone, just like you were given any other medicine, to solve or mask or Band-Aid a symptom you were having, a hot flash. Here's your medicine. What is causing the hot flash? You didn't know. They didn't tell you, but the easy fix and the way you were bamboozled was to take a synthetic plant sterol. Is that our normal cholesterol? No. It is a plant. I can't say plant cholesterol because they don't have cholesterol. They have plant sterols. So you're taking a plant sterol in place of our normal animal sterols, cholesterol, in hopes that it will solve your problem when, in fact, it is causing more problems. How? Well, it's giving you something that is blocking the natural production of your own. But I feel so much better. Then take it. But I'm telling you that it's fake. And it might work up front, but down the line, it's going to stop working. Are you at risk of blood clots? It depends on what's in there. If you're just taking estrogen, could be. If you're just taking testosterone, could be. If you're taking progesterone in combination with all those other things, think about what progesterone's doing to you. Yeah, but it calms me and helps me sleep. It also makes you really, really hungry, right? It's a hunger hormone, progesterone is. You mean that's why I'm gaining weight? They told me that I need to exercise more and eat less. Okay. All right. Well, how's that working for you? When was the last time you tried to exercise more and eat less? You might have lost your maybe 10 pounds, but then you couldn't live up to it. You couldn't actually say, you know what? I'm just getting hungry and hungrier. Well, here's some more progesterone. I can't sleep. I'm hungry. Here's some more progesterone. It's fake. Well, how do you get around all that? How about clean yourself out of all the plants, get off of the fake plant sterols, eat natural foods like animals, eat high amounts of saturated fat so I could produce my own pregnenolone, which will stimulate my adrenal gland to make DHEA, and then DHEA will help convert to androstenedione, and androstenedione will convert to testosterone, and all estrogens are made from testosterone. Okay? I'm not on estrogen, but dealing with significant tendinitis related to lack of collagen, decreased estrogen. Or are you relating your lack of collagen to your poor nutrition? Not enough good proteins, not enough complete proteins, not enough amino acids, not enough saturated fat. Oh, doctor, that saturated fat thing, that was what's causing my coronary artery disease, so I gave that up. I've been doing coconut oil, and I've been doing avocado for my fat. That's plants. That's not cholesterol. So you'll never get your body, once your ovaries shut down, you're menopausal, your adrenal glands will never kick in and make your things. You could, nutritional deficiencies is not due to your lack of estrogen. Was estrogen a component that was higher in your body previously? It could be. But your adrenal glands, 85% will kick in and make all of your estrogens. But you didn't maybe not wait that long. Maybe you didn't change your diet. Maybe you didn't go keto or ketovore or carnivore, increase your fat content 2-to-1 to protein. Maybe you didn't give that enough chance. Maybe you didn't give it any chance. Maybe you continued to eat salads. Maybe you continued to eat smoothies. Maybe you continued to believe eating oatmeal would lower your cholesterol and decrease your heart rate, or excuse me, decrease your risk of having a heart attack. Maybe you're still in that believing process, and you decide, I'm just going to take the path of least resistance, and I'm going to take these hormones, and I'm miraculously going to build up collagen. No, you don't have any protein. You don't have the amino acids. You don't have the saturated fat. How are you going to build collagen? Miss Young says, I believe weight loss is a function of nutrition. I believe that too. I believe weight gain is a function of our nutrition. Are there any other questions, you guys? Is there any questions? I do believe that if we were to look deep into, if we were to review and we look deep into what causes heart disease, because that seems to be, most people are fearful of heart attacks and cancer. And I think if we actually knew that most heart patients have abnormal glucose levels, I mean, really abnormal glucose levels, meaning they're above 80. Doctors do not look. If it's not 126 or 140, your glucose levels to them is normal. 73% of all heart victims have abnormal glucose. And if they don't have abnormal glucose yet, they have abnormal insulin. Everybody should be checking their insulin level. If your doctor will not check your insulin level, I will order your insulin level. It will cost you about $10, at most $35 to get your insulin level checked in the fasting state. So these heart victims, that 73% of them have abnormal glucose and insulin, also have normal LDL. So you can see why this would be maddening to me, to see doctors simply put patients on statins with, prescribing statins and ignoring what I consider, and maybe you too now, the elephant in the room, which is glucose, which is carbohydrates, which caused oxidation, which led to higher risk of infections. It all just keeps adding up, and it's like dominoes. But when we start listening, when we continue to listen to a reductionist person talk about things like LDL as the only cause of why we have heart attacks, I'm telling you, in the next few years, a lot of holes will be poked in that story. It's already changing. If you were to look back in the 1930s, 40s, cholesterol was the cause. Then it was just LDL. Now it's certain LDL. Now it's ApoB. No, it's not what you eat. It's what your body is making, and your body's flawed. It's a mess. Really? Now you're going to blame it all on God? That must be the nurse practitioner that's 3 steps above God. Gilbert says, I'm a truck driver. What can I do for bad circulation in my legs? At the end of the day, my legs are swelled up. Why are they swelled up? Is it just because you're a truck driver? I don't know if you have, if you can put your cruise control. Do you have cruise control? If you put your truck on cruise control for maybe a minute, 2 minutes, and you pump your feet, get blood flow, have you tried wearing compression socks during this time? Have you tried stopping your truck, getting out, and going for a walk, doing jumping jacks, doing calf raises? Have you considered why you get swelling in your feet, but maybe some of your buddies don't get swelling in your feet? Have you had your insulin level checked? Do you have diabetes? Insulin causes water retention. Insulin causes salt retention. Salt plus water retention equals swelling in your legs. And so do we simply just give you the compression socks? Do we tell you to pump your feet? Yes. But did we also look for the underlying cause? Gilbert, what are you eating when you're in your truck? Have you had an ultrasound or a venous duplex of your legs? Do you know if your arterial flow is okay? Probably is. Do you know if your venous flow is okay? Probably not. That's why you're getting the pooling. Okay. What's your iron level? Well, what does iron have to do with my swelling in my legs? Well, iron overload damages veins. So does insulin resistance. So do nanoplastics. So do infections. Gilbert, what can you do? Go to a doctor who will draw labs on you, all the labs. Gilbert, if you need a list of labs, email me, IronLadyDoc@AOL.com, and I'll send you a list via email of pertinent labs that you should ask your doctor to obtain. If they won't, and it's really worth it to you to get the labs, email me back and said, my doctor won't order these. Can you? I can if you're in a certain state. However, insurance will not pay for that. And that could cost you $350. Dr. Christie says, I just love listening to your thought process. Christie, sometimes it is an illness and it can be bad because your thoughts are always going all the time, thinking about details, thinking, and never shuts off. But once I kind of get on a thought process, I really, truly like to bounce these things off of people. Yes, Miss Young, how much fast food is truck driver consuming? Exactly. Truck driver didn't tell us all those things. We don't have enough details to make. We can speculate, Miss Young. We can speculate that they go to the truck stop, park themselves, and eat fast food, which is hamburgers and fries and polyunsaturated fatty acids, and then have a bunch of snacks like cookies and cakes. And we can speculate all we want. Only Gilbert knows what he is eating. Only Gilbert knows whether or not he should look into why he's got swelling in his legs. Instead of, oh, doctor's right. I pump my feet and things get better. I wear compression socks, things get better. I get out of my truck and go for a walk and things get better. But what damaged the veins in the first place? They're not going to get any better. They're already aged. You can prevent further damage by controlling your glucose, treating your nutritional deficiencies, treating your infections, checking for clotting diseases, avoiding toxic environment. Yes, you can do all those things. But you have to start somewhere. And just simply, your question was beautiful, Gilbert. And the reason I say it was beautiful, because you just got me to talk, because these are the kind of questions that you would ask your doctor. And the doctor is going to give you the exact things that I just told you. Wear some compression socks. Get out of your truck frequently. Pump your feet. That's all they're going to tell you. They're not going to tell you why you feel you have bad circulation. Did they check you for diabetes? Oh, I don't have diabetes. My A1C is okay. My glucose is, my blood sugar is fine. What's fine? Well, my A1C is okay. What's okay? Well, did they check your insulin? No, they didn't check my insulin. They don't even know what it is. They told me they don't do that. Well, find somebody who does do that. If you know that you need your insulin level checked because you want to know if you have diabetes before you get real diabetes, are you going to just wait for your doctor to say, oh my gosh, Gilbert, your blood sugars just went through the roof? Well, they didn't just go through the roof. They had been going through the roof for 10 years. You just never looked. I know, you didn't know. Now you do. Get an insulin level. Easy, easy peasy. Ruth says, I see Janelle's at Walmart and think how sick some people are. I see Janelle's. I don't know what's going on. What do you mean? I missed it. Miss Young, you're very welcome. This is what I love to do. I love being that person who's got this thought process with all kinds of things, because when I start talking and thinking through these things, you guys start opening your brain. That was the compliment Dr. Christie was just giving. I love listening to your thought process because I'm triggering you to use your brain. And you're going to start using those kind of thought processes. Because sometimes when you're just talking, this was magical. It was miraculous. I would do this kind of thing with a patient in my room. Okay? They would come in like Gilbert did and said, I got all these thinking things, or these swelling things. And I would just start talking and they would go, oh, well, you know what? Blah, blah, blah. And so they started using their thinking cap. And then we were like bouncing things off of each other and it was beautiful. It was magical. And then now we're partners in your healthcare. I'm not paternalistic, like saying, oh, Gilbert, you got, you have swelling in your legs. I'm going to send you to the vascular surgeon and they're going to run a bunch of tests and they're going to see if you need vein stripping and sclerosis therapy. And well, maybe you're just a lost cause. And Gilbert, do the best you can. Why don't you try to exercise more, eat less, and, get some better sleep. And yeah, don't drive your truck as much. That's it. Just don't drive your truck as much. Yeah. Israel Jason says, LOL, God is all powerful, omnipotent, but also not responsible for bad things happening. Allows, not responsible. Allows you, person, you have free choice, and you are the responsible party. Oh, Dawood, thank you. Hit the like button, you guys. People need to hear this, Dr. Iron Lady speak. Thanks. I appreciate your, I appreciate your kudos. That it means a lot. But my goal is just to provide some information and hope that it will inspire you to go looking, is to open up your own brain. Like I said, I could be wrong. And that's why I talk to my talk to you guys. I'm talking to myself. I'm talking to myself in a box right now. I can't see any of you. I can't see you going like this or going, mm-mm. I can't see that. All I can see is your name, maybe your question or your comment, but I'm just running this by myself and thinking and hope that you will start thinking too. So yes, please hit the like button. Please subscribe, share, do that thing. I'm going to skip to the end again on YouTube because there's a lot of riffraff. Promise Progression says, in other words, stop eating sugar, stop eating 3 meals a day, exercise more. Maybe the more means do some resistance training, get muscle mass because muscle is the organ of longevity. Maybe drink more water, but not over drink water. Maybe you drink water instead of coffee, water instead of soda, water instead of Gatorade, water instead of whatever. Drinking more water could look like just drinking when you're thirsty, but not choosing soda or coffee or tea or whatever it is, Gatorade. So thank you, Promise Progression. Yeah, we need to do those. It seems like really, really easy things to do. Miss Young says, I'm deeply researched and you reinforce all of what I learn. Everything you talk about are topics I have read about or listened to in presentations. That is what's awesome, right, Miss Young? Is that you're now building up, it's not, I don't want to say ammunition, but you're following a procedure that is, I don't want to also say that you're in an echo chamber. I don't want Miss Young to be in an echo chamber where she's only going to listen to people who is feeding her experiences. Sometimes, and I don't like it either, Miss Young, we have to hear people talk that are not in our echo chamber. Because as I spoke yesterday, the experience we have in our cup right now is because we are in an echo chamber all of our life. Our experiences that we have in our cup usually align. That's why this whole game with changing my apparel. When I asked you guys, if you send me something and I wear it, like if Eddie from California sends me a Dodgers something or other, my thing was that I was going to get rid of something that I have had in my possession for long periods of time and just couldn't get rid of. I couldn't empty out the experiences. I couldn't make a change. But if I make it public and I have you guys to say, hey, so what did you get rid of something for that Dodgers cap or the Dodgers jersey? Or yesterday somebody sent me a Timber hoodie, which I happened to leave at my mom's. So here I have a Timber hoodie, and so I have to get rid of something that I've been accumulating in my echo chamber. Well, it meant something to me because that was from high school and it had this memory and that memory. Okay, maybe that's not the item that you get rid of. Maybe it's something else that you've not used or worn for years and years and years, and it really has no significance except that, it's kind of cool to have something that's 50 years old, 40 years old, 30 years old, 20 years, I don't know. But yeah, same with our experiences. We collect our experiences, we're in an echo chamber, and they're all echoing the exact same thing. Until we dump out some of those experiences, empty out our closet, we can't add in more experiences, more fun apparel. Yes, you could, but it's defeating the purpose. Some of you say, you know what? I'm just going to go through the trash bag and take stuff to the Salvation Army. Great. That's great. But if you never emptied out your experiences, you cannot get more. You might accumulate the exact same things. I threw that away and I really needed it. Now I'm just going to go buy the exact same thing. Not a good plan. Not a good plan. Maggie says, where's your practice? I now practice from home. I only do consultations online. I am in Iowa. Doc Jensen, is there any good advice for postmenopausal women who want to build muscle? Lift weights, eat saturated fat and protein from animals. You need to be eating if you're going to lift weights, you need to eat at maybe, not medical advice. This is not medical advice. It's for information purposes only. So if you guys thought any of this was medical advice, it is not. It's for information purposes only, a little bit of entertainment. You want to get 1 gram, consider getting 1 gram of protein per pound of body weight if you're lifting weights. You want to eat, if you're postmenopausal or menopausal, postmenopausal, you want to double your fat. Maybe if you're 120 pounds, you want to eat 200 grams of fat and 120 grams of protein. You want to lift weights. You might want to slow down on cardio. Okay? Those are some of the things that you might want to do to build muscle. If that is not working for you, consider a consultation. That's what I do. I work from home, online, doing consultations with people. I go over their labs and I give suggestions that they can talk to their doctor about. Some people don't have doctors. I'm not their doctor. You're not my patient. But I can give information that can allow them to make a better decision for themselves. That's what it's about. Gathering enough information to make a good decision. If you have no information, you can't make a decision. You should not make a decision without information. You should not. Do we do it? Yes. Because we trust, sometimes haphazardly. Calisthenics body weight exercises are amazing. I don't know who this is because they don't have a name to them. I can just say Green Dot. Green Dot says calisthenics body weight exercises are amazing since they help with balance and bone density. So anytime that you are lifting your body through space helps your bone density. If you go swimming or you're an astronaut and go up in space, that is not helping your bone density. Lifting weights causes contraction of the muscle. When the muscle contracts, it pulls and tugs on the muscle. When that pulls and tugs, it strengthens the bones. Weight-bearing exercises. Now, calisthenics at some point aren't going to be able to build muscle. They might tone you, but you're losing muscle faster because in an older person who's postmenopausal, you're older, you're over the age of 50, okay? Your muscles are not just going to grow out of thin air. In fact, they're going to be sarcopenic out of thin air. So you need to do something over and above. You need to lift weights to failure, a heavy enough weight. Not, I can lift this weight 100 times. How about I'm going to failure on 10 reps? Now you're building muscle. Now the muscle is contracting and pulling and tugging, and you're going to get enough protein because bones are not made of calcium. Are they made of calcium? Yes. Is that the only thing they're made out of? No. 60% of bones is protein. Most postmenopausal women are protein malnourished. They're malnourished in general. Does this person who's malnourished want to fast? No. Do they want to maybe eat in a time-restricted window? Yes. They might want to get 120 grams of protein in 2 meals and get 200 grams of fat in 2 meals. Oh, I just got notification. What is the date today? It's the 9th. My little Nitro passed away. No, his birthday. His birthday would have been tomorrow. I just got notification. You guys didn't need to know that. Okay. All right. So the weight-bearing exercises, yes, and adequate protein, yes, adequate fat, and then good sleep, get out in the sun, stand barefoot on the ground, get grounded, all of these things. All of these things. Sheila says, sorry, my internet keeps freezing. I don't know why that is. Miss Young says, I'm at a point in my life where I'm my own doc. I use my primary care physician to order labs so I know what I'm doing is actually healthy. I mean, it's really sad when we have to use our doctors like that, but you know what? You probably are your best doctor. What DCT says, Doc, what do you think about cataracts of the eyes? I think it's sugar on your eyeballs. I think it's iron overload on your eyeballs. I think it's infections on your eyeballs. I think it's nutritional deficiencies on your eyeballs. I think it could be some clotting problems on your eyeballs. Definitely environmental toxins. Your water, your microplastics, nanoplastics, your skincare, your toothpaste, all of it. And their treatment is, let me just give you new eyeballs. I've seen cataracts go down in people who go carnivore. So All right, we have gone 2 hours. I'm going to get some stuff done. Not that I wasn't getting stuff done, but just know that I am here for you guys. If you want to consult with me, just email me at IronLadyDoc@AOL.com. Iron, IronLadyDoc @AOL.com. Schedule a consult. If you want to learn about diet and exercise, schedule a consult. If you want me to go over your labs, schedule a consult. If you want help with ordering what kind of labs, just email me. I won't charge you. If you want a list of labs to ask your doctor for, email me. I got 3 yesterday. 3 people emailed me yesterday because I told them that I would do this for them. 3 people emailed me. No strings attached. I just emailed their list so they could take it back to their doctor. You too, Dr. Christie. Thank you. I appreciate it. You have a blessed day as well. So if you want a list, a good list of labs, I'll send you a pertinent list. Are there other, there could be different labs, but I'm just going to give you what I like to look at, okay? It's quite extensive. If I order them for you, your insurance won't pay for them. So try to get as many of them ordered by your personal doc. And if something doesn't, if something doesn't get ordered, I can try to help you. So IronLadyDoc@AOL.com. Sign up for a consultation. Ask me if to get a list of labs. I can do all that, okay? I am live every Saturday at 9 a.m. Central and every Sunday at 10 a.m. Central. And then I do reels most every day of the week, just on a topic. If there's something that you want to learn more about and I know something about it, I'll do a reel on it, okay? But otherwise, like, subscribe, do the clickety-clack stuff. It helps. It helps everybody, okay? Because I bet that you have a question.
Let's take on a big question people